Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today, back by popular demand, is Fiona Hallinan. Welcome, Fiona.
Hi, Kristen. Lovely to be back.
Welcome back. And you have a presentation for us this year in our Gold Midwifery online conference titled Strategies for Fetal Malposition Recognition and Response. It's a big one. It's something that we all deal with in, in midwifery. So this is important and I can't wait to talk about your presentation. But first, let's talk a little bit about you. You, of course, are a midwife, and let us know where you are in the world and tell us a little bit about your background.
So I'm a midwife in Melbourne, Australia. I don't work now directly with birth. I teach mostly internal pelvic release work, and I work inside the pelvis and outside the pelvis now. So I'm not directly with birth, but I'm hopefully influencing birth, and then also seeing women a lot postnatally as well, and along life journey. So yeah, I like many midwives, the on-call gets too much and needed regular hours. I'm getting to be a bit of an old girl now. So yeah, but that's what I'm up to.
Yes, fantastic. And it's such an important work too, because as you mentioned, you are involved prenatally and postpartum. And obviously that also affects birth, right? And we learned so much about positioning, how important good positioning is, and not just like baby is upside head down, right? We're talking really about positioning here. From your experience, what do you see, or what have you seen, or when you work now with women, what contributes to fetal malpositioning?
Well, I know when I was in practicing as a midwife, whether in hospitals or privately for home birth and the like, I hated babies in the ROP position, right occipito-posterior. And I think a lot of midwives get frustrated with babies in certain positions because it activates a whole range of futility within us. And we know that often those labours are longer and more drawn out and are therefore incredibly taxing. And if they're in the hospital system, we know that the interventions come at that woman thick and fast because birth's supposed to be in a certain time, isn't it? So I always had a great deal of frustration with that, but I tried hard and I had a lot of different skills, but I realise now at my age of 61, it's almost like in my later years, a whole lot more sense has clicked into my brain, more about mechanics and a way, way deeper appreciation of the role of the baby and then the needs of the child. You know, we live in a very cervix-centric environment where if the mother opens, what's the problem? We have a birth.
Right.
Many of us on a birth see women with a fully open womb. Their cervix has got out of the way beautifully, done its job. Thank you very much. But she still ends up with a cesarean. And that's then our Western medicine culture not considering the needs of the child, what helps that child move through. So I've got more and more and more curious about that. And it's really, it's like at my age now, I've still got another 20 years to work, I reckon. But it's like wanting midwives now working directly with women to get some of those pennies that have dropped for me late to hopefully drop for them earlier.
That's wonderful. Yeah, thank you so much. You described something there perfectly. The cervix, we're so centered, that we forget all the, the other factors that are also so important, right? So, and there's so much we can do already prenatally, correct? I mean, I assume with posture, movement, activities, we can do certain things. I can tell you from my own experience with my first baby, unwittingly, and I put myself in a situation, or put poor baby in a situation. I was in early labor and I was laying in a hammock and I was like crunched in a weird position, and I could feel that something shifted, and all of a sudden I was in real big pain. So I unwittingly put my baby in a, in a not good position, right? So there is so much we can do or tell our families and women about that and educate them so they don't, after that, every woman I talk to, I made sure to tell them, don't do that, because that or how to avoid it to have this, right? So Fiona.
And it's also, working with a woman in her pelvis, and our world sees her just as she is, but the pelvis is a static presentation. And many women end up getting told they don't have the room to get a baby out, particularly if a baby got caught up the first time. There's very few women who don't have space. Every now and then, yes. But geez, it's not like the way the world is making out. Because sadly, our Western medical world doesn't consider that the soft tissues that join bones to bone can morph, can increase. So if you see a woman like that, you're not understanding that she has not reached, with support, her anatomical potential.
Anatomical potential. I like that. I like that word, that phrase. Yes.
And that's where many women end up having that first time cesarean.
Mm-hmm.
And say a baby got caught up. Maybe it was posterior baby. She gets caught at 4 centimeters, 4 centimeters, 4 centimeters, or the classic 7 centimeters, 7 centimeters. Oh, the baby's posterior. You're not going anywhere. We're going to go to theatre because it's only going to happen later on anyway. So let's just go now. And you just think, wow, does she really not have enough room? And then how does that same woman next, when she's prepared her body, and create and really address potential imbalances in her body, in her soft tissue, that have then influenced the baby,
right,
to address those situations, then she births the baby vaginally and she's had a successful VBAC, and everyone goes, oh, wow, isn't that brilliant? It is brilliant, but it's working towards us trying to prevent that for the first birth.
Right.
So she has to endure that suffering. She never has to go through that grief or that distress that I wasn't able to get my baby out of my body, my pelvis wasn't big enough, and fall into that belief.
Yes, and fall into that belief that something is wrong with her, yeah, absolutely. What I'm also interested in, Fiona, is the role of the baby, right? We always often I remember in the textbooks and all that, it's always like the baby is always described as this passive passenger, but the baby plays an important role. It makes all these cardinal movements, of course, right? So tell me a little bit about the role of the baby here.
Well, it's exactly what you say. Like we were told it was a passive thing, and as midwives, and guilty as charged, did it too. We often, when a baby's in great position or doing a different thing, moving back to posterior rather than coming round a short way to anterior, the baby, we often call the baby a cheeky Charlie, a naughty baby, stupid little bugger, these sort of expressions. Did it too. Regret every time I've said something like that. Because we got that indoctrination that, your cervix opens, the baby will come sort of thing. Yeah, the baby spirals through, big deal. We don't pay any attention to it anymore. We're forgetting that the child is coming in with its own intelligence. The child's coming in with a very switched on central nervous system. It's not a passive person. I always say to women, our world makes out that birth is a ballet solo by mother. A waltz with another human being. That baby works with mothers and does different things to mother's tissues. It activates hormonal responses and nerve responses, and so it dances on. And without that, the two working together like that, birth doesn't happen. But the child is coming in with a very switched on central nervous system in the main. Yes, sometimes we have unwell babies. I get it. I know that. But we're not talking about those babes.
Right.
Because they are very much the minority. But this child is wired in its DNA, like we were, to know how to be born.
Mm-hmm.
If the child didn't know that, the human race would have died out.
Absolutely. Yeah.
And the baby's natural way of being, the primitive reflexes are to be in a form of to move in a spiral, to be curved up like a leaf, like a fern. And we know then that, in any time you feel a baby in the belly in pregnancy and you feel that gorgeous flexion through the spine, I say to the woman, oh, this baby is switched on in the central nervous system, because that baby's natural way of being is to be curved up. And that's a beautiful telltale sign that we have a baby in a comfortable position and we have a baby ready to fulfill primitive reflexes of spiraling through the pelvis.
Beautiful. Yeah, I could listen to you forever because you describe it so perfectly and it makes so much sense the way you're describing it. It really is a wonderful.
It goes on to, after the babe's born, these babies stay curled up like a fern that has to unfold.
Yes.
And I know, and around the world we do, we follow the principles of SIDS and we lie babies on their back like this. So we've got them permanently in a startled position.
Startled position. Mm.
Natural thing is to be curved and unfold gently. And then we've got all these sleep issues in the postnatal time in the children. And then us clever white girls go, no, don't worry about it. We'll set up all these sleep schools and we'll force them to sleep in that way. Anyway, I digress.
Yeah, but you're absolutely right. We should really go and look at nature, what nature intended in this position, in this gentle uncurling. What a wonderful way to describe that. And of course, after birth, right away, skin to skin, tummy to tummy, onto the breast. And then you don't have that the baby lays flat, right? Like you have this kind of, this breast crawl or coming, and that's initiated by the baby and not so much, that's how, it brings me great joy to see that we're getting away from this. And also in hospitals that, how they wash them, bundle them up, and then they give them to mother, that we're no longer doing that. Hopefully, in many areas now that, the baby is brought to the breast or skin to skin right away, in many cases, which is a great improvement. So Fiona, before I let you go, what are final wise words when it comes to this topic here today for our viewers?
Oh, I think the most important thing is to not close your mind, to keep, and not to feel humiliated when new pieces of information fall. If I look back on my midwifery practice, I could cry with things I didn't know and I didn't do. And it actually makes me emotional to think about it. Certain births where I think, oh, why didn't I do? And it's just to allow new knowledge to keep coming in and new pennies to drop into our brain, because sometimes our brain needs more time for integration. We get something and then we get something. And I've had a whole career, 35 years in the job of, yep, I know that. Someone says it a different way, or I've seen it a different way and gone, oh my God. It clunks in. And so it's like when people are humble enough to sign up to listen to other speakers and myself, how beautiful, are humble enough to do that. My message is keep staying humble, because there are little pieces of essence of knowledge that might resonate with your brain that give you this more glorious, fuller experience and understanding, and it never ends. I'm 61 and there are pennies still just dropping.
Yeah. And you know what? Isn't that wonderful? Isn't that wonderful? Always learning something new and, improving what we know and help having others have a better birth that way. And you're right. I have the same feeling where I go, if I had known all that I know now, But yes, but never stop learning. I totally agree with you. So
I
much.
think the thing is, there was a wise man once said, when I felt so much regret about different things, and of course, as a mother, you always feel regret.
Yes.
Don't you? Oh, never. But a wise man once said, regret means we're getting smarter.
Oh, I like that. Regret means we're getting smarter. Well, Fiona Hallinan, thank you so very much for being here with me today and talking about the work you do and about the upcoming presentation. I'm really excited. I can't wait for it.
It was a joy and a pleasure. Thank you for having me.
Yeah. And now some information for our viewers. This presentation, Strategies for Fetal Malpositioning, Recognition and Response, is part of the Gold Midwifery Online Conference of 2025. And this presentation particularly will be live on February 11th. But next week on February 3rd, we're getting started with our open access free keynote presentation. So make sure you check that out and reserve your spot. And you can do so by going to goldmidwifery.com. So I hope to see everyone at the conference. Bye-bye, everyone.